Hi, my name is Sheena Erickson, and this is my presentation on gentle persuasion and dealing with difficult clients for my interviewing techniques class taught by Dr. Neil Sagi. Gentle persuasion is a permission-based approach using respect, empathy, and logic rather than force or manipulation. It aims to inspire positive change without coercion. Gentle persuasion focuses on building a trusting relationship with the client. There are 7 principles of persuasion: reciprocity, scarcity, authority, consistency, liking, consensus, and unity. Reciprocity is an exchange of support that aims to create a healthy, balanced partnership between client and counselor. It consists of validating the other person's feelings, even if you don't agree with them. An example, a client shares vulnerable feelings, and the therapist empathizes with the client and offers understanding in return, creating a safe space for the client to continue sharing. Scarcity. It's a persuasion technique used to guide the client towards feeling that their sobriety is an urgent need they want to address. Scarcity can be applied to convince people to buy into our suggestions, follow our advice, or accept our guidance. Authority. Set rules, establish safety, and balance. This is based off the fact that we often trust powerful people and their expertise. It's human nature to seek guidance. When we lack direction, we seek help from someone else we view as knowledgeable. Example of authority: a counselor increases their influence by being likable and respectful. This involves validating a client's feelings and being patient with their pace in therapy. Consistency. Be consistent in your words and actions. Clients are more likely to engage with their therapy when they know what to expect. A structured environment is valuable for those working through complex emotions or trauma. Example: have a predictable and reliable demeanor. Maintain a calm, stable, and non-judgmental presence from session to session. Liking consists of using empathy and reflective active listening. You want to let the client know that you genuinely hear them and understand what they are telling you. This involves more than just hearing words. It's about validating their emotions so the client feels heard and seen. The compliment should be specific and focused on the client's efforts, insights, or character strengths. Consensus. It's a mutual agreement between the therapist and the client. A process where everyone works towards a decision that everyone can support, even if it's not the first choice. How to build consensus effectively: set clear objectives and shared goals. Create an open and respectful environment. Listen actively and acknowledge every voice. Facilitate a structured discussion. Use decision-making techniques, and address conflicts transparently and fairly. Unity. It's a sense of togetherness attained by building trust, understanding, and love between individuals. This is when an individual has a clear, integrated sense of self, with their emotional responses and behaviors matching their thoughts and values. The clients reach a state of cognitive harmony. Their beliefs are consistent, and they display mind-body connection, and they express their feelings more effectively. Some gentle persuasion techniques are active listening, building rapport, ask open-ended questions, use positive language, and mirroring. In active listening, we create a safe and trusting environment. We concentrate on the client's verbal and nonverbal messages, pay attention to what is said, and what is implied. We want to help the client feel heard and supported. To build rapport with the client, we genuinely empathize for the person. We do that by focusing on active listening, asking thoughtful questions, avoid interrupting the client, make it all about them, and use positive reinforcement language. Some examples of open-ended questions would be, what do you think about this? How can we improve this? And how does this make you feel? What are your biggest strengths and why? And what does this remind you of? How can we make learning this easier for you? And what are your thoughts on this? The sixth gentle persuasion technique is positive language. Be proactive. Use validating language, such as, I can see how this might be really difficult for you, or I can see you are in pain, or your feelings are valid and it's okay to feel this way. I'm here to help. What do you consider your greatest strengths? You have good ideas, or you worked hard on blank, or you knew just how to stay calm in that situation. Mirroring. Mirroring, also known as reflection, is a verbal and nonverbal sign of connection that can be a powerful communication tool that helps with expressing empathy and engagement. Paraphrasing what they've said to confirm understanding, reflect it back to the client. The underlying idea is that you are showing them things that they cannot see on their own. There are two types of mirroring, verbal and nonverbal. Some of the common nonverbal cues and what they can mean. Leaning towards the counselor indicates that the client feels safe and is absorbed in the conversation. Leaning back in the chair, it is likely they want space or may not like what is being said. Movement away towards me, this usually indicates an increasing involvement in the conversation. Moving away indicates fear, disagreement, or a desire to disconnect. Mirroring posture indicates we're having a safe, interesting discussion and the client feels in accord with me. The client holds a throw pillow or another object in front of their chest. The person feels unsafe and the pillow is acting as a protective barrier. Dealing with difficult clients. Difficult clients are resistant. They often display reluctance in therapy or refuse to change their behavior. This may be defensive, evasive, or openly resistant to therapeutic interventions. This resistance can stem from fear, insecurity, or a lack of readiness to confront their issues. Resistance in therapy is common. Clients may initially exhibit resistance as they struggle with fear of change, confronting difficult emotions, or just adjusting to the therapy. Resistance can be associated with issues from anxiety to past traumas. There are few types of difficult clients. There are silent ones, overly vocal, resistant ones, demanding clients, manipulative clients, or unreliable ones. How to deal with silent ones. Just slow the pace, use active listening, and avoid pressuring the client, as silence can be a necessary part of their process. Practice active listening by reflecting back what the client has said to show you are present and empathetic. Some examples of things to say to a silent client: this is really hard for you to process, or take all the time you need. It's very normal to feel at loss for words. I really value your presence here. Thinking about change is really hard. This is your space and I completely support you. I am so proud of you being here. How to deal with overly vocal clients. A client may be talking excessively to fill a silence or to manage anxiety about the session. The client may not feel heard in other areas of their life and is taking advantage of the counseling space to be seen and validated. In some cases, a client may use a rapid stream of details to avoid a more painful or deeper issue. Guide the client back on track by connecting their long narrative to the core issue. An example would be, could I just pause you for a moment? Let me make sure I've got all this right. It sounds like you're saying this, and this. Is that correct? I'm hearing a lot of important details. How does this particular story relate to the goal we set at the beginning of our session? How to deal with resistant clients. Don't push the client to disclose things they are not ready to share. Instead, back up and join them in their current state. Avoid viewing resistance as defiance. Instead, see it as a sign of ambience, fear, or a protective instinct. The counselor should try to connect with the client's reality rather than focus on their own agenda. Use open-ended questions to help the client explore their personal experience without influence. Let the client sit and silently experience their emotions, even the uncomfortable ones. How to deal with demanding clients. Demanding clients deserve no less empathy and understanding, but it can be tough when someone is not respecting limits and boundaries. How to deal with a demanding client? Just set your boundaries. Have open communication. Keep those boundaries in place and practice self-care. How to deal with manipulative clients. You will commonly encounter clients who try to control or steer the process in their favor. They are called manipulative clients. They might consistently change topics during an uncomfortable issue, or they might try to gaslight you. Tips for working with these types of clients: just share your observations with them. Let them know about their behavior. Set some expectations for them to address this behavior even. Be prepared to refer them to someone else that specializes in their specific behavior. How to deal with unreliable clients. They'll often cancel appointments at the last minute or fail to follow through with therapeutic assignments. Just remember, all behavior is a form of communication. Address the unreliability directly, but not judgmentally, and involve the client in problem solving. Priming can be applied to therapy when dealing with difficult clients. This can be used to prepare clients for upcoming events, reduce anxiety by activating positive associations. Priming can be used to subtly influence people's attitudes and behaviors. If a person's goal is having a peaceful, drama-free life, we would use the word sobriety as a way to attain those goals, which will help the client see sobriety as a way to achieve their goals. There are 3 states for adults in counseling. The 3 brain stages of clients in counseling are the survival state, emotional state, and the executive state. In counseling, understanding these states helps identify a client's needs, and the goal is to move them from survival or emotional state to the executive state through connection. Survival state, that's fight or flight. In survival state is where we feel triggered by threat. These skills are fight or flight or surrender. An example of a person in survival state in counseling is a client who shuts down emotionally, struggles to make decisions, and responds to minor stress with irritability or anxiety. Your mind and body are just trying to protect you, and it's a natural reaction to being overwhelmed. Emotional state. Emotional state is our response to upset and can only be soothed through connection. An upset emotional state is triggered by the world not going our way. It limits our ability to see from another's point of view. This unconscious state keeps us on autopilot, so our words and tones match authority figures from our childhood. We revert to disciplining the same ways we were disciplined, even if we know these behaviors to be ineffective or hurtful. Executive state. The individual will be more goal oriented and motivated. When they face a difficult situation, they learn from it instead of reacting. They can think and act more rationally because their emotions are regulated. They are open to considering new perspectives. They will become more empathetic and see things from another's perspective. Thank you for listening to my presentation on dealing with difficult clients and gentle persuasion.